That little pill sitting on your nightstand, the one you take every single morning for your blood pressure. It feels like a safety net. Everyone you know over 60 seems to be on one, but for many of you, that same pill is quietly the reason you feel exhausted by noon. It is the reason your legs feel like lead when you try to walk the neighborhood. It might even be the reason your weight is creeping up, no matter how little you eat. In all my years in medicine, I have almost never heard a doctor in a busy waiting room mention what I am about to tell you. But what I have seen consistently in patient after patient changed how I think about blood pressure care for seniors. There is a specific type of medication called a beta blocker. You might know it by names like metoprolol, atenolol, or carvedilol. For decades, it was the go-to choice. But the science has shifted. For many of you, this pill is not just lowering your numbers. It is working against your body's natural rhythm. By the end of this, you will know exactly why the shift happened, what the latest research actually says, and the specific questions you can take to your next appointment to make sure your treatment is helping you, and not just your blood pressure chart. Let me be perfectly clear about something. Most of us grew up believing that as long as the blood pressure cuff shows a good number like 120/80, the medication is doing its job. That feels logical. If the fire is out, you assume the hose did its work. But the science has moved forward. We now know that blood pressure is about more than just a number on a screen. It is about how we get to that number. Think of your heart like a car engine. A beta blocker works by putting a Rev Limiter on that engine. It literally blocks your stress hormones, that is, your adrenaline, your body's natural spark plugs, from reaching your heart. It slows the heart down and makes it pump with less force. Now, if your engine is overheating or has a broken part, a Rev Limiter is a lifesaver. But if you are trying to drive up a hill or just walk up a flight of stairs, that limiter becomes a problem. The gap between what most people believe that any low reading is a good reading and what the evidence shows about your long-term health is exactly what we need to talk about today. After enough years in medicine, you start seeing the same story told by different people. I remember a patient like many I have seen over the years, who came to me at 68 years old. He was a retired teacher. He loved gardening, but he told me, "Dr. Michael, I feel like I am walking through chest-high water every day. My doctor says my blood pressure is perfect, but I feel terrible." He had been on a beta blocker for 5 years. In that time, he had gained 15 pounds. His blood sugar, which used to be fine, was now in the pre-diabetic range. His previous doctor told him he was just getting older. When we looked at the patterns, the same patterns I see in so many seniors, the picture changed. He was not just aging. He was experiencing the side effects of a medication that the medical world is starting to realize might not be the best first choice for simple high blood pressure anymore. That is why today I want to walk you through 6 specific things, all backed by evidence, that show why your blood pressure choice matters more than you have been told. Number 1. This one comes up more than almost anything else in my conversations with patients over 60. It is called exercise intolerance. Remember that Rev Limiter analogy. When you take a beta blocker, your heart has a ceiling. It cannot beat faster, even when your muscles are screaming for more oxygen. If you try to play doubles tennis or even just carry groceries from the car, your body wants to turn up the power. The medicine says no. This makes you feel winded, dizzy, and heavy. A major study published in the journal Cochrane Database of Systematic Reviews looked at thousands of patients. They found that beta blockers were often less effective at preventing major heart events than other medications, partly because they make it so hard for people to stay active. After about 2 weeks on these, many people notice they just stop wanting to move. And as we know, movement is the best medicine we have. This is a conversation worth having with your doctor if you have felt slowed down lately. Number 2, the metabolic mud. This is the one that surprises people. Research consistently shows that certain beta blockers can actually increase insulin resistance. Think of insulin like a key that lets sugar into your cells for energy. When you have resistance, the key does not work. The sugar stays in your blood, and your body stores it as fat, usually right around the middle. A landmark study called the ASCOT trial, published in the very respected journal, the Lancet, followed over 19,000 people. They found that patients on older beta blockers were significantly more likely to develop a new diagnosis of diabetes compared to those on newer types of blood pressure medicine. If you have noticed your weight creeping up or your blood sugar numbers rising since starting your pill, it might not be your diet. Most people notice these metabolic shifts within 90 days of starting the medication. Number 3. The stroke paradox. This is a point that gently challenges what we used to believe. For years, we thought a lower reading on the cuff always meant a lower risk of stroke. No. The research tells a more complicated story. The same ASCOT study I mentioned earlier found something shocking. Even when the blood pressure numbers looked the same on the outside, the people on beta blockers had a 23% higher risk of stroke than those on other medications like calcium channel blockers. Why does this happen? Because the beta blocker lowers the pressure in your arm, where the cuff is, but it might not be lowering the pressure in the big artery near your heart as effectively. It is like checking the water pressure at your garden hose but ignoring the pressure in the main pipe of the house. Number 4. The fall risk. This is critically underappreciated in older adults. As we get older, our internal sensors that manage gravity need to work perfectly. When you stand up quickly, your body has to tighten your blood vessels so blood does not fall to your feet. Beta blockers can slow down that response. This leads to something called orthostatic hypotension. That is just a fancy way of saying a dizzy spell when you stand up. Evidence consistently points to an increased risk of falls in seniors taking these medications. For a person over 70, a single fall can change everything. Statistics show that hip fractures in seniors carry a very high risk of losing independence. If you feel even a little bit of a head rush when you get out of bed, please tell your doctor. It is a 2-minute conversation that could prevent a serious injury. Number 5. The cloudy brain. Many people report feeling a brain fog or even a low-level sadness while on these medications. Because beta blockers affect how your nervous system communicates, they can sometimes dampen your mood or your memory. Research suggests that because these pills can be fat-dissolving, they can actually cross into the brain. If you have felt not quite like yourself since changing your heart meds, you are not imagining it. Many people notice a lift in their mental clarity within 30 days of a supervised medication change. Number 6. The sleep struggle. This is a side effect that many people do not link to their blood pressure pill. Beta blockers can interfere with your body's production of melatonin, that is the hormone that tells your brain it is time to sleep. This can lead to vivid dreams, trouble falling asleep, or waking up at 3 in the morning feeling wide awake. Over time, poor sleep makes your blood pressure even harder to manage. It is a frustrating cycle. Let me give you something concrete, a real, simple plan, the kind I walk through with patients before they leave my office. First, look at your pill bottle. If the name ends in OLOL like metoprolol, atenolol, or carvedilol, you are likely on a beta blocker. Second, I want you to start a simple 7-day log. For the next week, write down how you feel 2 hours after taking your pill and then again in the late afternoon. Are you hitting a wall? Are you dizzy when you stand? This data is gold for your doctor. Third, when you go to your next appointment, do not just ask for a refill. Ask your doctor this specific question. Based on the current evidence, is a beta blocker still the best first-line choice for my blood pressure? Or should we consider a calcium channel blocker or an ARB instead? Common alternatives like amlodipine or losartan are often found at any grocery store pharmacy like Walmart or CVS for just a few dollars. They often do not have that same Rev Limiter effect on your energy. Fourth, ask your doctor specifically whether the timing of your medication could be adjusted. Sometimes, just moving a dose from morning to evening can change how you feel all day. Fifth, request a formal medication review. If you have been on the same blood pressure medication for more than 2 or 3 years without a reassessment, you are entitled to ask for one. Many seniors are taking medications that were the standard of care 15 years ago, but have since been reconsidered by new research. Before I let you go, I want to say something directly. Everything I have shared today is based on current published research and patterns I have observed over many years of working with patients. It is educational information. It is not a diagnosis. It is not a prescription. It is not a substitute for your personal medical care. You are a unique person with a unique history and unique needs. Your own doctor, the one who knows your chart, is always the right first call for anything specific to you. Please use this as a starting point for better conversations with your doctor, not as a replacement for those conversations. I must be very clear about one more thing. Never stop or change a beta blocker on your own. These are not like a vitamin you can just quit. If you stop them suddenly, your heart can experience a rebound effect. Your heart rate can spike dangerously, and your blood pressure can skyrocket. It can even trigger a heart attack or a dangerous heart rhythm. Any transition away from these medications must be supervised by a physician and done gradually, usually over 4 to 8 weeks. I have seen what happens when people ignore the small things long enough for them to become big things. That is not a place I want you to be. Which is exactly why I make these videos. I think back to that retired teacher I mentioned earlier. Once he worked with his doctor to transition to a medication that better fit his lifestyle, he was back in his garden. He told me he felt like he had finally stepped out of a fog. I want that clarity for you too. Tell me, which of these things do you notice most? Is it the fatigue, the dizzy spells, or maybe you have been on these for years and feel great? Type the words "checking mine" in the comments below if you are going to look at your pill bottle today. I want to see how many of us are taking our health seriously this week. I read every comment. I mean that. If this gave you something real today, something you can actually use, hit like. Not for the algorithm, for the next person who is feeling exhausted and does not know why. Your next video is already waiting. It is about something that happens inside your arteries every night after 60-something with no obvious symptoms, that most people only discover after something serious has already happened. It is one of the most important videos I have made. Watch it next. Take good care of yourself.